And good morning. My first task today is to get something out of the way right at the start of this event, and that's the definition of open innovation. And we don't want to get too hung up on definitions, because today is really about moving forward from that and learning from other people's experience of open innovation. So we'll just get one out of the way right now. You can change it later on if you like. I'm not married to it. As is often the way with definitions, this has been developed partly from my own experience working in open innovation and also from other people's insights, including Stefan, who's one of our speakers later on. So I like to think of it as a form of collective intelligence spread across multiple organisations, and it's often characterised by very effective, even radical use of connections and networks to share ideas and experiences and expertise. And this connectivity is vital to open innovation. The classic activity here in open innovation is crowdsourcing, putting out an open innovation challenge to anyone who's out there to come up with a solution to a given problem. A two-way street for ideas and expertise. This isn't just about hoovering up everybody else's ideas. There has to be some give as well as some take. Equitable partnerships and collaborations rather than supply and demand transactional relationships. And all of this means that sometimes we need new business models in order to maximise IP and other assets using open innovation. So there's some examples coming up, but basically what this means is if a company is doing all its R&D in-house, it's not doing open innovation. If instead it's using crowdsourcing to generate ideas, or it's sharing data for free in order to stimulate the next stage of research for everybody, then it is doing open innovation. And there's always a degree of subjectivity in how we define any type of innovation, but this is our starting point for open innovation. And I want to just emphasise three aspects of working that I think are fundamental for open innovation. So connectivity. We're inspired by what we can see others are able to do, or what they're not able to do. And if we're well connected, then problem-solving methods can be translated from one sphere of work to another. Individuals who are well connected to several diverse, different networks are at a higher risk of having a good idea. And if you want to find out more about that, look up Professor Ron Burt in Chicago. Collaboration. Innovation is a contact sport. One person might have the idea, but it always takes a collaborating team in order to turn that idea into a product. Researchers, advisors, investors, and so on. And the better connected we are, the more likely it is that we'll find the right collaborators each time. And challenge in two senses. Firstly, open innovation challenges to generate ideas, as I mentioned before, and also in the sense that if you are well connected in a diverse network, then an idea can be challenged from multiple angles, and that's how you turn a good idea into a great idea. And all of this is about increasing your risk of having a good idea and making it work. So what? If companies are using open innovation, what difference does that make? And other sectors have seen the benefits in terms of increased revenues, improved success rates for innovation, and so on. And there's some well-known examples here. Anything from gold mining to space tourism, from toy building bricks to Formula One software being translated over to national air traffic control systems. And in the bioscience sector in particular, we can already see the early adopters that have made some bold moves into open innovation. So Procter & Gamble, quite famous now for deliberately radically changing how many of their ideas for new products came from outside the company, and they doubled their revenues in the process. Eli Lilly, a very strong leader in open innovation in this sector, plenty of examples there, including their current open innovation challenge around tuberculosis. AstraZeneca, currently making 22 key compounds available free of charge with clinical data to public sector researchers in a very interesting partnership with the MRC. GlaxoSmithKline with the Tres Cantos Open Laboratory and other initiatives, and we've got Patrick Valens coming up next to tell us more about that. And Tabio is interesting. This is an antimicrobial startup which has successfully used crowdfunding as its very early stage finance. And then we have those multi-partner alliances that go right across the industry, many big pharma working together, sharing data and expertise at pre-competitive stages. There's Transcelerate, there's the Pistoia Alliance, there's the Structural Genomics Consortium, which establishes the 3D structures of potential drug targets and openly publishes the results. And then, of course, we've got Stevenage Bioscience Catalyst, SBC. And today, at lunchtime and in the afternoon, we're in the SBC Incubator building, which is just a few seconds away outside the front door to this building. And the biotechs being incubated there can use the cafes and leisure facilities and the canteen and the shop and so on that the GSK researchers use. And SBC is helping those tenants to find the right connections within GSK or somewhere else. If the tenant doesn't want to collaborate with GSK and needs to instead interact with someone else, that's absolutely okay. And that's exactly how an open innovation campus should work. And we've got more coming up from Martina Picardo later this morning to tell us about that. And just a final note on what is open innovation, what it's not. Obviously, it's not the cure for everything all the time. You use it selectively when it suits your business. But it is underused in this sector. And that means opportunities are being missed. And that's why we're here today. So that's enough for now about what open innovation is. I'm going to use my final few minutes to talk more about what the future holds for open innovation in the bioscience sector. And firstly, there will be more. There will be a lot more. The train has left the platform and it is moving. And I think it will transform the problem-solving approach of this sector. And I think that's probably a prerequisite for any plan to maintain profitability and sector growth and at the same time give us medicines that we can afford. I think we'll see a lot more crowdsourcing, not just aimed at researchers and specialists, but aimed at patients and carers and end users to help identify unmet healthcare needs and possible solutions. And I also think we'll see open innovation being used a lot more as a tool to support the development of cross-sector, multidisciplinary innovation as we see technologies converging even more. Now, I'm going to use an example from the digital sector just to illustrate a point here. And this comes from Bran Ferrin of Applied Minds. And he likes to talk about a presentation he reckons he's seen at dozens of different conferences. And what happens there is a speaker will put up a graph that looks like this. And it represents the digital revolution. So it's a number of people who've got a mobile phone. It's the trillions of bits of information that are now moving around. It's the amount of memory that a handheld device can now handle. It's the digital revolution. And then according to Bran, the speaker will say, now, there's another line on this graph, and that's your business. And you look at the graph, and you're not quite sure what's going on, but you know that bit where the lines cross probably isn't a good place to be. And then the speaker will say, we're not adapting fast enough. And the time to panic is now, because where we are on this timeline is here. And then someone in the audience will stand up and say, this is nonsense. This speaker's just scaremongering. Where we are on this timeline is here, so that's okay. And then someone much younger in the audience will stand up and say, you're all wrong. Where we are is here. All your companies are dead. You just don't know it yet. And then if you're very lucky, you'll have a real visionary in the audience, like Alan Kay, who gave one of my most favourite quotes about innovation. The best way to predict the future is to invent it. Great quote. But he's very strong on the point that when it comes to the digital revolution, we're actually right at the start. You know, hardly anything's happened so far. Okay, the last 20 years have been utterly transformed in work and leisure because of digital technology. But we're only just beginning to get the hang of all the things we could be doing with big data. Things like quantum computing will be probably a practical reality in consumer products within 30 or 40 years. So when it comes to digital, there's actually a whole lot of future ahead of us, and relatively not so much history behind us. So that's enough about digital, no more about digital. Going back to bioscience now. So here's another graph. This is a completely different graph to the previous one. I hope you've noticed that. This is open innovation in the bioscience sector. So it's the number of big pharma that are using crowdsourcing to answer a research problem. It's the number of biotechs that are starting to reap the benefits of working with big pharma in that way. More cynically, it's the number of companies who are putting out publicity saying we're doing open innovation, but in fact they're not doing anything really of the sort and probably won't until all the competitors have done it first. But back to the positive stuff. It's the number of companies, number of startups thinking of looking at crowdfunding as their very early stage funding. It's the number of those multi-partner alliances that share data and expertise for the benefit of everyone equally. It's open innovation in bioscience. Now, there's another line on this graph, and that's your company, your organisation. And it starts up here, there it is, which begs the question, where does it go next? Does it go down? Does it go up? And the truth is, of course, when it comes to open innovation, especially in this sector, we are right at the start of this graph. Okay, it is 10 years now since one or two of the very early adopters started ringing the changes. But for the vast majority of organisations in bioscience, open innovation is a pretty new thing. And that means you get to decide. You get to decide where that red line goes. And for your organisation, where that red line goes will depend more than it does today. It will increasingly depend on how much you lead and take part in open innovation, but more fundamentally, it will depend on how much your organisation deliberately sets about improving its skills base for things like collaborating with other people, opportunity spotting, pushing the boundaries of the company to see what could be done differently to strengthen the core. Because the truth is, innovation is an attitude more than a project or a process. It's about the way you work. It's about the nature of the collaborations you're comfortable having with other people. It's about the way you solve problems, the way you fail and learn from it, the way you manage change, the way you make things happen. And this is true of innovation and doubly so of open innovation. So I'm going to leave you with a question. What's your risk of having a good idea and making it work? And what are you doing today and tomorrow to improve your risk of having a good idea and making it work? Thank you.
Thank you. Just while the mic's going up there, I organised a CBI ICARG meeting here about, I think it must be about seven or 8 years ago. And because I was organising the day, I was flying around, but they were also doing video clips to go on YouTube. And I was the last person to get interviewed, and I knew all the answers. I was machine gunning the answers out. And then the guy said to me, and what do you think about open innovation? I went, what's that? So that's on Praxis Unico, and then the guy described what open innovation was. I thought, shit, that's what I do for a living. Dope. Please.
Good morning, thank you. Crowdsourcing, it's a great opportunity to raise interest and finance, but how do you see us not leading to disillusionment in the crowds where things don't get delivered?
I think that's a very good question, and quite often it is a classic situation. A company will think, yeah, let's do some crowdsourcing, but they don't prepare themselves to manage the volume of ideas that might come in and to handle the feedback properly. And it's really fundamental. And I always advise any client that when they are doing this, they shouldn't get too carried away with making sure they're paying attention to the winners. Obviously, they need to do that, but they also need to provide some proper feedback to the people who didn't in order to encourage them to put ideas forward again. And it's like anything else in management. You need to plan it and resource it and manage it. And make sure that you do have people ready to handle all those ideas that are coming in, make sure they're judged properly, make sure the feedback gets there, and critically make sure the winning ideas then get carried forward in the process of actually turning them into a product. And the person who put forward that idea is kept in touch properly and involved in it properly. And very few companies actually do put enough resource into that. They need to ask themselves, who's going to manage this? what do they need to delegate to someone else in order to make time to manage it? And not enough people do that. And that's what I meant at the end about deliberately improving our skills at collaborating with other people. You know, these are important issues and they need to be managed properly.
Thank you.
Hi there.
Hi.
You mentioned about innovation being an attitude, and you just mentioned going back to skills and capabilities. Do you have any good examples of companies who've actually gone ahead and changed the culture to make it much more innovative, and how did they actually achieve that?
I think it's obviously when you come to changing culture, it's a very difficult thing. You don't switch it on overnight or next Tuesday because that's when you planned for it. And it is a very slow process. I mentioned Procter & Gamble, who did really take the open innovation to heart. You know, they really did change how the company worked. But the important thing here is to carry everyone with you. You know, this can't just be a top-down decision. It needs to be something that also comes from each level of the organisation so that they are contributing to how it all works and how it works for them as much as how it works for who they're collaborating with. It needs to be integrated that way at each level. If it's nothing but top-down, it's just going to look like, why is my job changing? Why are we bringing in ideas from outside instead of using my ideas, and so on. There's a lot of disillusionment that you could engender if you're not quite careful, quite canny about how you manage that. And again, it's something that some companies trip up on. You know, there are some not so good examples out there. I won't mention those ones. But it's absolutely key. So much of this comes down to how you manage people's expectations and how you make them feel in the work that they're doing. I believe that absolutely. You know, it's not a Gantt chart, and it's not a stage gate diagram. It's people and relationships that really make this buzz and make it work.
There's an absolutely,
Chris,
there's a
can you get a
great.
mic to Phil?
Hang on a minute. There's a great audience here today. Could you just say who you are and your affiliation before you ask your question?
Bill Dawson, one of the advisory group of SBC. But Claire, you said in the middle of that talk that you thought this was part of the solution. Open innovation was something that you could use when it was appropriate. For me, that's a really critical thing. We have seen so many new schemes of doing things in research and in development over the years, and they are all, in my mind, part of the toolbox. Would you like to just have a comment about, because I think many of us sitting here come to a day on open innovation and think, gosh, is this everything that we have to do, or is it part of what we do, and is part of the discussion about how we use it?
Absolutely. It is one tool in the box, but obviously there are other tools in the box. And sometimes the best thing to do for your own organisation is to keep something more confidential or restrict the number of collaborators you have. But the key point here that it is being underused, and it could be used a lot more. And part of that is getting over the fear sometimes, the concern that open innovation means giving away your IP or something like that, and it doesn't. You know, it's like anything else. You take things to a certain stage, and then you start getting the lawyers involved. But it's not an additional risk, I don't believe. It's really about more collaboration and acknowledging the fact that whatever organisation you work for, not all the smart people in the world work for you, and there's a planet full of other people who can do it as well. Zainab, there's someone there.
Wonder here? Come down.
I've already got mine.
Yeah, go on, away you go. Fill your boots.
I don't need a mic. Andrew Bernard, my company's Innovative Enterprise. Claire, you mentioned culture change. Now, culture change is massively about trust. How do you involve people and carry them along? You mentioned that's important to do. How do you kind of go along the process of starting that trusting process with all the people that are involved?
I think there's a number of answers to that. I mean, one is understanding where they're coming from and what matters to them in the process of collaboration you're about to go through, and managing their expectations. and delivering what you promise. You know, like any collaboration, you deliver what you say you will, and you never over-promise, because that way leads to a definite lack of trust. I don't think there's anything particularly different about this. It's like any collaboration that needs to involve trust. Manage the expectations, deliver what you say you will, and that trust will develop.
I can see that's a real fine balance, because you want
It
to
is.
be kind of expansive enough with your ideas in the first place that people are going to come involved. But that under-promise, over-deliver is a very fine balance, isn't it?
It is, yeah, it is.
Stan, you had a question?
Stan Roberts, Manchester University. Clare, you mentioned crowd finance at one stage. How do you stop the crowd becoming a herd and all going after the same subset of topics?
I love that, herd finance. Someone should write a paper on that. Well, crowdfunding is basically, if you're a startup and you need 50 grand for your first proof of concept, you could get that from 1 or 2 business angels, or you could get 500 people to put in 100 quid. But you stop it being a herd from, firstly, managing the numbers, you know, how many of those very small financiers you do take in. And there are very different approaches to this. Sometimes it's in return for a tiny bit of equity. Sometimes it's not equity, it's a kind of bonus that they get in the end. But there is a session on this afternoon, a breakout session, crowdfunding in the bioscience sector. And I think if we have Simon Howarth in the room, is he here? Can we get a mic to Simon just to see if he can add to something like that? Because Simon and Shaya Masrani, Christina Patino are leading that session this afternoon.
Yeah, hi. Indeed, the session this afternoon has an emotive title to tackle this issue, which hasn't worked well in biotech. The crowdfunding method hasn't been applied well. And so this afternoon's topic is about discussing that and seeing what is being done about it, what the options are, and what we think we need to do about it. So it's a session this afternoon, just after lunch.
Nice plug there. Round of applause for Clare, please.